The fuck is up, guys? I'm so happy to be able to talk with you guys again. If you've seen my short form content, then you might get a little idea of what today is about. If you are new here, welcome. I am Leah. I'm a single parent. I am originally from the States, but relocated to Europe. And I have one goal with this whole entire channel: to teach you how to have better standards, better boundaries, more quality life, and today about your body. I work in the operating room, so I communicate a lot with different surgeons that work in different areas, but I really love feminine health. And so me and GYN surgeons go like this, unless they're a man. And then I basically talk shit the entire time. If you watch my short form content, then you will know that I am pretty expressive. I do have to tone it down for YouTube just because they block all of my content where I express myself too much. I'm going to chit chat with you about a few things that most women don't know about their bodies that they should, because school doesn't teach them because men were bored. 4 topics we're going to cover today is period, hormones, discharge, and BV. I wanted to cover BV separately because it is a lot of things that women struggle with, and it's hard to differentiate between BV, yeast infections, and UTIs. So I'm going to break down as much as I can in this little bit that I have with you, and then if you have any questions, feel free to drop them in the comments. I promise I will get back to you because I actually care. Let's go ahead and get into it. I fucking love covering periods because every woman almost goes through it, but nobody talks about it. It is such a taboo topic for no apparent reason at all. I never learned about periods. It was something that I had to figure out on my own. I got my first period when I was 11, right after my mother's funeral, and it was a confusing time after that. Here's just a few things that I want to break down to you, right? A normal period is 3 to 7 days long. If it is less than 3 days long, it technically is not classified as a period. And if it is more than 7 days long, that is concerning. Your period should not come and go. It should be straight through. You should not be bleeding for 3 days and then be off and then be back on. And that doesn't necessarily count as a period at that point. It is normal to sometimes have clots, but they should never be larger than a quarter. Let's talk about what happens between periods and pregnancies. Sometimes you bleed at inception. So if you had intimacy and the right precautions were not taken, it could be 2 days, maybe even up to 5 days later, and you have a little bit of spotting. That is not a period, and that is not a sign that your period is coming. That is a sign that you need to take a pregnancy test and look at your options. When it comes to cramps, cramps should not be debilitating. Cramps are like a little taste of what it looks like when you go into labor. Because when you go into labor, it's the same function happening in your body, just on a scale times 100, right? But just because it's a little taste does not mean it needs to be as painful as one. You honestly should not be having any debilitating cramps. Cramps that make you miss work, vomit, make unusual exhaustion is not normal. You should not be having cramps that severe. And if you are having cramps and it is not relieved with ibuprofen, Tylenol, a heating pad, that is also not normal. A lot of times women with endometriosis that do not get diagnosed excessively use heating pads, and they end up with scarring on their abdomen because of the heating pad. When it comes to your period blood, bright red, dark red can be normal. If it's brown, that's just old tissue and blood that is being cleared out. It could also be a sign that your progesterone is too high. If it is anything like gray, black, deep red, I would call and at least speak with a triage nurse about it. You can call a local urgent care. They usually have triage nurses that can take phone calls, or sometimes you can get a hold of Planned Parenthood over the phone. Depends on where you are. PCOS. This is a disorder that commonly happens with women when basically your testosterone is higher than normal. For those of you that don't know what testosterone is, that is the primary male hormone. Men and women both have testosterone and estrogen, just men have more testosterone than estrogen and women vice versa. But some women have higher levels of testosterone, which can sometimes give appearance to certain male characteristics. They don't look manly. I'm not saying that, but what I am saying is there's certain things that happen with the body, certain changes that can sometimes make that a little bit more prevalent. I personally have PCOS. I struggle a lot with excessive body hair, sometimes facial hair, and my periods are very wacky because of it. The stereotypical PCOS women that you usually see are women on the heavier side, excessive facial hair, excessive body hair, things like that. It presents differently in everybody. I have relatives that have PCOS as well, and they really struggle with facial hair and body weight. Symptoms of PCOS can include the excessive facial hair in the upper lip, chin, sideburn area, excessive body hair, wacky periods, not over bleeding, Periods with PCOS are usually under bleeding. You usually have missing periods, or it's very inconsistent if your testosterone is very high. Hair thinning is very common. If you tell your GYN that your hair is thinning without the other symptoms, they're just going to tell you that it is stress. It's very important if you are experiencing more than 3 of these that you document it and you write it down. Because just like if someone was to bring you a random fact without fact checking it, you wouldn't necessarily believe 100%. It's going to be the same way with the doctor. You want to make sure that you're documenting it, that you're writing it down, so when you do go to the doctors, you can present the information and advocate for yourself so they don't blow you off. When it comes to treatment to PCOS, there's a few things that they like to recommend. Birth control is one of them because you do need the estrogen that's in birth control. Let it be known though that you cannot do progesterone only birth control and see a benefit. Not if you have PCOS. It might help prevent pregnancy, but it is not going to help your symptoms because you need the estrogen that's in the other forms of birth control. Just keep that in mind. Also, there's a water pill called spironolactone that also helps with adrenal things. It's kind of an off-label use that they can recommend. But this is the one medication that there is no guarantee that it is going to work. If you do take spironolactone, it is very important that you keep up on your water intake because it is a water pill. It will make you pee. Discharge. And I made a video on this that ended up doing really well on Instagram and TikTok. But if you are here, like I said, YouTube likes to censor me. So I probably did not post that video over my shorts. So let's break it down here. Discharge is the one way that your vagina is really going to be able to communicate with you without saying too much. A lot of women just blow it off, wear liners, they don't pay attention to it. So if something is going on, you're not going to know until your vagina is on fire. If your discharge is clear, white, stretchy, that is normal. If you are ovulating, it might be more towards the white side. That is okay. If the discharge is gray, that is BV. If the discharge looks like snot and is very thick and mucousy, that means you need to get tested. If the discharge is like cottage cheese, that is a yeast infection. Okay, go get some Monistat. Do not do Monistat. That is only 2 days. That is not going to clear it. I usually recommend the week long. Some people do the 3-day and see some benefit. User discretion. If it is brown outside of your period, again, that is probably high progesterone, and that would be something to go get checked out about or at least call. I recommend getting an STD test every year to every 6 months, depending on how active you are. Just because you don't know, and the best treatment is early treatment. Next up, we're going to talk about BV versus yeast infection versus UTI because these often get confused, and I want to make sure that you guys have the information that you need to be able to discern whether this is a UTI, yeast infection, and to get the appropriate help. All right, so for this, pay attention and screenshot when you need. So as mentioned, we're going to go through BV, yeast infection, and UTI so you can spot the difference. To reiterate, BV has gray and fishy discharge, yeast infection has cottage cheese, and UTIs usually don't have any discharge at all. BV usually comes with mild itching or irritation. Yeast infections have crazy itching and irritation. It's hard not to miss it. And UTIs have a sense of urgency and frequency, meaning you're constantly feeling like you have to pee and it's constantly happening all the time. When it comes to the actual physical experience of what you can see, the only one that actually has any physical appearance is yeast infections. Yeast infections commonly have a lot of redness, swelling, and soreness. You're going to be able to actually see it on the outside and it's going to be extremely uncomfortable. But with that being said, UTIs, while they don't have any external physical appearance, their urine is what usually calls it out. It's going to be dark, cloudy, and it's going to smell god awful. The worse it smells, probably the worse the infection probably is because all of that bacteria is just sitting in your bladder. Yeast infections and UTIs both have discomfort when it comes to peeing and intimacy. While technically the UTI is more discomfort in the urethra because of how close it is to the vaginal canal, that's why you have the discomfort with intimacy. 3 different problems, 3 different treatments, 3 different ways to take care of your body. I hope this helps. I know we went over a lot today in this video. Like I said, if you guys have any questions at all, please drop it in the comments because I want to be able to help you as much as possible. If this is something you really enjoyed, please like it, share it, follow me so I can continue to help build my community. I would love for you to be a part of it. And I love y'all. I'll see you on the next one.